You've seen recently in the news that New York Governor Andrew Cuomo was trying to limit the number of people that could attend a residential Thanksgiving dinner. This caused quite the stir in New York and has led to chatter amongst people on Facebook. But what is the math behind a super spreader event?
Welcome. Glad you can make it. My name is Victor and welcome to Random Data Analysis, where I analyze relevant but random data that you might see in the news or social media in order to help you get a better understanding of the numbers behind these articles and posts. In episode 2 of Random Data Analysis, I help you calculate the probability that your holiday dinner will be a super spreader event.
Now, a small disclaimer, believe it or not, I am not a medical doctor, nor do I have a PhD. I'm just a guy with a large interest in data analysis, and this channel is just kind of an outlet for me to share some interesting things I uncover about some relevant topics. And now, back to your video. So, a little bit of background information to put everything in some sort of context. The CDC did a study to better understand how COVID spreads throughout the community that was titled Community and Close Contact Exposures Associated with COVID-19 Among Symptomatic Adults, and this study was published on September 11th, 2020. I also used this report in my last video, which was about the effectiveness of masks, and to see that video, you can click the link above or in the description box. In the report, it listed the top 3 causes of COVID spread. Number 1 was spread through family members or the same household, where people would take their mask off at home. Number 2 was restaurants, where people would take their mask off to eat. And number 3 was bars, where people take their mask off in order to drink. The obvious theme here is that whenever someone takes off their mask, their chances of being exposed to the coronavirus greatly increases. Now, I think it's a safe bet to say that Andrew Cuomo and most public health officials would know about the study, and putting 2 and 2 together, they knew all 3 risk factors family, eating, and drinking would likely all be present at all holiday parties, and so they asked people to keep gathering small so that large family dinners would not turn into a super spreader event. So, what exactly is a super spreader event? Remember when Trump got COVID and then several people who attended the Rose Garden event also got COVID? That was a super spreader event. Now, if you watched my first video about the effectiveness of masks, I found this photo while researching the video from USA Today that shows you who did and didn't get COVID at that Rose Garden event. Of the 11 people that got COVID, only one was wearing a mask. And if you zoom into this one section, you see one person wearing a mask, yet they are surrounded by 4 people who got COVID, all of whom were not wearing a mask. And somehow, this one person who was wearing a mask didn't get COVID. It really is a true breakthrough in science. So for the purposes of our calculation today, I'm going to use Erie County as Andrew Cuomo has really singled them out in his press conferences. So step 1. In order to make this calculation for your potential super spreader holiday event, you're going to need some information. Fortunately, all the information that you need is publicly available. You just need the following pieces of data for your local county. So the first step is to find your key publicly available data. With a quick Google search, I found that Erie had a population of about 919,000 in 2019. This next part was a bit harder to find, but many websites have this data tabulated for easy use. We need to find the infection rate, and for Erie, that rate is 1.16%, which means that each person who tests positive is infecting 1.16 people. Lastly, you need to find how many new COVID cases there were for the past 10 days. Check your county health department or do a Google search. I found the data on Erie's Department of Health website that created a COVID dashboard. I just scrolled down to the new case widget to grab the data from there. So for step 2, you need to calculate the probability that any one individual you meet in the general public will not have COVID. Some of you might be asking why I'm using 10 instead of 14 days. It is because the CDC has recently revised their quarantine requirement from 14 days to 10 days, and so for the purposes of my calculation, I'm going to use the new guidelines of 10 days. As I mentioned earlier, to get this information, I counted up the daily confirmed cases using the Erie County Department of Health website. And so for Erie, the 10-day total was 5,903. Now, this group of 5,903 people are hopefully in quarantine since they have tested positive, but we know that based on the data, those 5,903 have likely infected many other people that are yet to be diagnosed. So in order to calculate that, we have to take the infection spread rate of 1.16 and multiply it by that 5,903. So it is likely that there are around 6,847 people out in public with COVID. So based on that number and a population of 918,000, we can turn that into a probability. And so we take 6,847 and divide it by 918,000 for 0.745 or 1 in 334 people. For simplicity, we will call this the individual COVID positive index or ICPI.
Conversely, we can turn the COVID-negative people into a probability. We take 913,000 divided by 918,000 for 99.255%, or 133 in 134 people. For simplicity, we will call this the individual COVID-negative index, or ICNI.
So what this means is that any person you meet is 99.255% likely to not have COVID or a 1 in 134 chance to be COVID positive. It sounds pretty safe, right? But let's do some math to find out just how safe it really is. Before we get into the more complex math, let's do a bit of a warm-up to calculate your individual risk based on how many people you interact with over the last 10 days. So get into use your brain dummy mode and count all the people you have interacted with in the past 10 days. As a reference point, there was a study I read that said the average person has 13 different interactions per day pre-COVID. Now, with the social distancing and COVID related restrictions, for most people, it is likely that they interact with fewer people. I know I certainly do. I haven't left my room in days. So, for argument's sake, I'm going to say my average is 5 per day for 10 days for a total of 50 interactions. Again, this is not me. Like I said, I have not left my room in days. I need help. So, based on that math, your individual risk is 99.255 to the power of 50, or 68.8%. That means you have a 68.8% probability of not interacting with any undiagnosed COVID person, or a 1 in 3 chance of having interacted with at least one undiagnosed COVID positive person for any 10-day period, assuming COVID numbers stay about the same. So next, let's take it up a notch and do the same calculation for a family. Say you have one person that works from home, a parent that is an essential worker, and two kids that are going to school. Based off of that, one parent might interact with one person a day, parent 2 could interact with up to 15 people a day, and both kids would interact with 12 people a day at school. If you add up all daily interactions, that is 1 plus 15 plus 12, which is 40, and you multiply that by 10 for 10 days, so you have 400 total interactions. So for an average family of 4, their family risk, based on this math, is 99.255 to the power of 400, or 5%. That means you have a 5% probability as a family to not interact with a single undiagnosed COVID positive person, or you have a 95% chance of having interacted with at least one person who is an undiagnosed positive. And this is across any 10-day period, assuming COVID numbers stay about the same. Now, to calculate the risk for your dinner party, let's say you invite your brother or sister's family of two parents and two kids, with the same number of interactions, 40 per day for 10 days. This would give your dinner party of 8 a group risk based on math of 99.255% to the power of 800, or a 0.25% probability as a group of not interacting with a single undiagnosed COVID positive person. Or you have a 99.75% chance of interacting with at least one person who is an undiagnosed positive. Now, this does not mean just because you had an interaction you will get COVID. If you're following the guidelines, it is unlikely, but what this does tell us is that you will probably get a contact tracing call from your local health department sooner or later. So just as a comparison, I did all the calculations for you in this handy dandy informative chart. Or as my chemistry teacher would call it, a sexy chart, because charts are sexy, and they allow you to see data easily. This chart shows you the probability that for every extra person at your dinner party has of interacting with at least one undiagnosed person. So based on this chart, you can see how quickly you get to 100% based on how many interactions each person has had and how many guests are invited. Now this is only one view, and this isn't even the scariest chart. But in this calculation, 100% doesn't actually show you how many people you might have interacted with that might have an undiagnosed positive COVID test. For that, we actually need a simpler calculation. To do this, we need to know your group's average number of interactions and how many guests and multiply that number by the individual COVID positive index, or ICPI, or 0.745%. So if you had 8 guests that averaged 10 interactions per day for 10 days for 800, you multiply 800 by 0.745%, which turns into 6 undiagnosed COVID positive people. So to save you from doing all those calculations, I did them for you in this amazing and informative chart. You can see here for your reference is our family of 4 at 3 undiagnosed COVID positive people, and over here you can see our party of 8. But, as you can easily ascertain from this table, you can see how easy it is to get to 10 based on how many guests and how many people everyone interacts with. Now, if you want to see how many total interactions that is, here's a table that shows you this. An average family of 4 with 10 interactions per day for 10 days is 400 interactions, while a dinner party of 8 with 10 interactions a day for 10 days, you get 800 interactions. And you can see how easily you can get to 1,000 interactions. Now, if you take these numbers for Erie, you can match it up to any super spreader events that you might have seen in the news. There was a 55-person wedding in Maine in August that led to 30 guests contracting COVID-19, and then 147 COVID cases and 7 deaths due to further community spread. The numbers would be this area: 37 to 93 potential exposures if it occurred in Erie today, but at the time, Maine positivity was relatively low, so it was likely 5 to 17. There was also an 83-person wedding in Ohio in October that led to 32 guests contracting COVID. Today, the equivalent in Erie would be in this range: 37 to 186 possible exposures. Then you will say, hey, those are some pretty large gatherings. What about smaller ones? I don't exactly have 55 people to invite over. Well, there was a 6-person family party in North Texas that led to 14 other family members testing positive for COVID in July. Today in Erie, this would be 2 to 11 possible exposures. There was also a 9-person funeral in March that led to 5 people being infected, and today in Erie, that would be 6 to 33 exposures. I assume due to the death that the 9 people would have interacted with more people prior to the funeral. And of course, we cannot forget the infamous White House Rose Garden event that had over 213 guests and staff. This led to 11 plus cases. Today in Erie, that would be in the 900 plus range, as many of those attendees are likely meeting 50 different people a day due to the public nature of their jobs. Now, I understand this analysis would be more complete if we had some study that showed infection rates based on the number of exposures or exposure time to COVID, but I couldn't find any research that would fit. So this is the best I could do. But perhaps if you're aware of a study, you can let me know and I can revise my stats. So for now, the best we can go by is more exposures lead to more cases.
Now, before I end this video, at the time of editing, this data came out and you can definitely see a post-Thanksgiving bump due to the spread that occurred, likely due to Thanksgiving dinner.
Now, for all you nerds out there, my analysis isn't perfect as it is more of a process of finding reputable data online and using that data to help draw conclusions. However, it is a good starting point to help people make their own decisions based on math and statistics. However, as I pointed out previously, one of the hardest things for a researcher to do is 1, find good data, and 2, eliminate their viewpoint or bias, which kind of screws me over because I need to find good data. In a previous video, I said when you have an agenda, you look for data that matches your viewpoint. But this should be sufficiently accurate for the purpose of a YouTube video. Mind you, I have seen some terrible academic papers in my day. Having said that, I would appreciate it if you could provide any kind of feedback on my analysis. It's similar to a peer review in academics, and I thank you in advance. So if you like this video and want to see another, please like and subscribe so that will encourage me to make more content like this. Thank you again, signing off for now. I am Victor with Random Data Analysis.